This year alone, 81,000 people will be diagnosed with kidney cancer. More than 14,000 will die from it, and renal cell carcinoma is the most common form.
Well, it can be difficult to treat because many symptoms don't happen until too late. Advancements in surgery, immunotherapy, and targeted therapies have significantly improved survival rates. And now, as Marty Salt explains, a new drug is giving patients more hope.
Chuck Straven is determined to complete his bucket list.
Watch all 4 girls graduate high school. Watch all 4 girls graduate college.
But in 2015, Chuck was diagnosed with a fist-sized tumor on his right kidney. It was stage 4 kidney cancer.
I didn't know that your kidney is literally only a little larger than your fist.
Traditional treatments for renal cell carcinoma are surgery, ablation, and immune checkpoint inhibitors.
These are some sort of an immunotherapy that usually target a specific protein in the cancer.
Now, doctors at the Dana-Farber Cancer Institute are using a new FDA-approved drug to help patients like Chuck. Belzutifan blocks HIF-2A, a protein crucial in tumor growth. In clinical trials, belzutifan reduced the risk of progression by 25% and had fewer side effects, giving patients and their doctors another way to fight kidney cancer.
Hopefully the time will come where patient, even with stage 4 kidney cancer, we can tell them, look, you have 50-50 chance of cure.
In the past 2 years, Chuck's cancer has not progressed, and
I proudly walked Kayla down the aisle. The most important thing on my list is grandkids. And having been a girl dad now for the last 30+ years, I'm pulling for a grandson or two.
Marty Salt, WGEM News.